I do get a question asked from a lot of my patients, we have some molding effects into our room or into our house, and how do we deal with the situation? Can it cause asthma? Can it make asthma worse? These are the questions that are raised with me. Hello, I'm Professor Dr. Syed Arshad Husain. I'm a consultant pulmonologist at the King's College Hospital. I also work as a professor adjunct in Gulf Medical University in the UAE. So yes, molding is not a good thing to happen into your rooms or into your house. And I think the important thing is to prevent molding happening. But once the molding has happened, then you need to get some professional treatment to clear the molding from the room or the house. The molding happens when there is dampness in the room, and it could be there's some water leakage or water stagnation somewhere in the house, or there is a lack of ventilation in the place where this molding is taking place. So it is very important to have good ventilation for your rooms. But if the molding has happened, then obviously it is very important to get yourself checked up, because if you did not have asthma, it could be causing the asthma. And if you had asthma, it could then cause the asthma to get worse. So this is very important that the lung conditions are properly assessed if you have exposure to molds. The mold exposure is obviously longer term experience, 3 to 6 months exposure with molding. So that becomes more important to check if you had developed any symptoms to suggest asthma, or spirometry can be offered to assess, or pheno test, exhaled nitric oxide test we do in the clinic to check for that. Sometimes people can develop aspergillus or fungal infection as well, so we do need to check that out. But the important thing is to also realize that the AC vents have also got these spores that go and sit there. So the external cleaning of the vents in the AC is very vitally important, at least once in 6 months, so that people don't inhale the fungus particles into their airways. When you have exposure to molds in the house, you could also develop redness in the eye. You could develop hay fever-like symptoms, apart from asthma that we've already talked about. You could also get skin-related problems as well, because if you're touching the molding areas or coming in contact with any of the environmental particles, then it could lead to skin-related problems as well. So it is very important not to let molding happen, but if it happens, to deal it with professional expertise and help. Make sure the exposures is not there sustained or long. The molding can be cleared off. It's just an early stage, especially the kitchen and humid areas are going to get molding. And if there's stagnant water or running water somewhere in the house, please make sure that has been cleared or repaired.